A local nonprofit organization is committed to enhancing the lives of those affected by advancing age or illness. Through their comprehensive system of healthcare choices, they deliver expert care and heartfelt support to guide the local communities. They have a fundraiser and care program that we want to tell you about. Coming up next on Polk Place. Welcome to Polk Place. I'm your host, Lauren Lingell. Joining me in studio today, we have Dr. Andrea Miller, who is the Regional Medical Director of Palliative Care.
Palliative Care for Chapters Health.
See, you have to help me because there's
That's
just so many things. And we have Michelle Gomez, who is with the Chapters Health Foundation.
Yes.
And she is got a hand in marketing, and so she's going to tell us some exciting things about your upcoming fundraiser. So tell me a little bit about what you do, Dr. Miller.
Okay, well, I've been a doctor for over 30 years. I started in family practice. I now do what is called palliative care, which is a new specialty. It's been around about 10 years, and it mainly focuses on helping people make sure that they maintain their quality of life and to make sure that the treatments that we offer them are going to help them with that.
So can you give me an example of a situation where palliative care would be applied or would be better for an individual?
Many people, for example, who have heart failure will have episodes of the heart failure where they get quite ill and end up in the hospital, and they get very, very sick and end up in the intensive care unit. Then sometimes they will improve from that and sometimes need to decide whether they should be going to a skilled nursing facility or back home again, and they're wondering what's going to happen next.
So is it like I need to work on getting better, or I need to be checking into hospice kind of thing?
It is talking to them about that in very real terms so that we can help them understand what their choices are, so that we can be sure that what we are doing, I always tell them what we're doing to them and is actually going to help them, as opposed to just being something that we're able to do because we have so much technology.
So what are some of the things, like, give me an example of some of the things that you work with them on specifically?
So there's two main focuses that we have. One is we help them with their decision making.
Okay.
So for example, if you had a demented patient who was in the nursing home, who was having a wonderful life in the nursing home, but was losing weight, they might need a feeding tube. If you had that same patient, but instead of having a wonderful life, she was crying and unhappy all the time in that nursing home, the choice of whether to do the feeding tube or not might be different. So what we do is we try to put together all the facts so that we can help people understand what is going to be helped by whatever we're planning to do and what really isn't going to change. Because we can help a symptom or a single problem for a patient but not affect their lifelong chronic illness. And that's important for them to understand. You know, it's like the old joke where they said, you know, Doc, am I going to be able to dance after the surgery? And he said, sure. And they said, that's funny, I never could before. You know, sometimes people will assume that we're going to improve their health in a way that just isn't reasonable.
Right.
And it's important for us to be really honest with them about that so that they can make the right decision for themselves.
Right. So in the instance of the person who may need a feeding tube because they're losing weight, but they're not mentally not happy, you can fix the feeding tube part, but you can't necessarily make them happy.
I can't make them happy, and I also know their disease, what's called the trajectory of illness, which is how their disease is going to change over time. And I can help them and their family understand what that means. So that if they're likely to to experience a lot of further discomfort. If they're already failing, maybe they have a pressure ulcer or something like that, then we know that their whole body is not doing well. It isn't just a matter of not feeding.
Right.
So we look at everything about the patient. We look at their family. We look at how they function. We look at where they're living. We look at what all the different diseases are. Very often, what will help one disease will hurt another. An easy example of that is everybody hears the commercials on TV that, about AFib.
Right.
And they all talk about this expensive new medicine that you can take instead of Coumadin for AFib and talk to your doctor about it. And that can work. And the purpose of giving that medicine is to prevent strokes. However, a lot of those people also have problems with their stomach and can have bleeding. So sometimes that person will come into the hospital and they have been bleeding more because they're on the medicine that they take for AFib that thins out their blood. So now they've got to make a decision. Which is worse? Which is better? Should I be taking the medicine to help me not clot so I don't get a stroke, or is that too dangerous to me because of my bleeding? So those are not easy questions to answer.
Does not sound
And they're
easy.
different for each different person, and they take spending time with that person and getting to know them so that you can really make the right decision. There is one other important thing that we do in palliative care, though, and that is that we help with complex symptoms. So what are complex symptoms? Well, all of our doctors take care of symptoms. Every doctor does. But sometimes those symptoms can be really difficult to treat. So we're particularly expert in taking care of some of the more serious and disabling symptoms like pain and nausea and vomiting, weakness, those kinds of things. And so we are used a lot by other specialists when they are focusing on the part that they need to focus on. Good example is an oncology doctor that deals with cancer. And they're going to be focusing on what the absolute best treatment is to be most likely to change the tumor so that it won't be as big and won't be as troublesome. That's their job.
Right.
They will also take care of symptoms if they need to, but sometimes those symptoms are really tricky.
Right.
And they need to focus on the chemotherapy. They give to us the job. We focus on making sure that the patient is getting what they need from the pain perspective.
So this makes perfect sense to me now. I wasn't exactly sure how that fit in. So a lot of times people will say, you know, this doctor just keeps giving me this and this, you know, and they're not so much concerned with the symptoms or the side effects of the medications because they're treating the bigger problem. Like a cancerous tumor or something like that.
They're looking at how can they prolong the patient's life and how can they do the most that they can do to both prolong their life and possibly improve the quality. We're very focused on how to improve the quality of life and how to be really honest with somebody about what the trade-offs are between treatments and not being treated or being treated in a different way.
Now, Chapters Health, a branch, would you say, is Good Shepherd Hospice?
Yes.
Okay. And so within all of that, not everything is necessarily a paid for service. Some things require financial support from donors. Is that accurate to say that?
That's very accurate.
Okay.
And actually we are not, the entire Chapters Health as a whole is a not-for-profit entity, and unreimbursed services provided in every single one of our entities, including palliative care.
Then yes, fundraising is very important.
It certainly
and
is.
this is where Michelle comes in
It
because
sure is.
she's got an event coming up.
Yes, I will
Vanessa,
bet.
tell me about that.
So, and as we mentioned, Chapters Health System is the umbrella company, and then I work for the Chapters Health Foundation in support of Good Shepherd Hospice. So the Chapters Health Foundation has an upcoming event. It is Rock the Dock, and it is at the Tampa River Center. It's coming up this October, Saturday the 26th.
Okay.
It's from 6 to 10 p.m., so all proceeds from this concert will benefit the Chapters Health Foundation. And, you know, as we mentioned, the foundation supports charity care. It supports special new programs we have going on, like the Special Wish program for our hospice patients, or special needs, something as simple as an air conditioning unit, that they just don't have the funds for that would significantly improve their quality of life. So it, while it's not it's a need that would help
if it's
them.
not painfully obvious to anyone watching. We live in Florida and it's very hot here, so
Absolutely,
it is certainly a
absolutely.
need. So I can certainly appreciate that.
The proceeds will also be benefiting our children's bereavement camps. And again, this is for the Good Shepherd community, which is Polk, Highlands, and Hardy. And then we have the Hillsborough community, which is the Life Path area, and HPH, which is Hernando and Pasco. So the camps host approximately 110 children or so every year. And it is a weekend-long bereavement camp open to any child in that service area who has suffered the loss of a loved one.
So where can people get some more information on Rock the Dock?
Rock the Dock.
And what's happening at Rock the Dock? Let me just back up for a second. What's
We
going
are
on here?
going to rock out at Rock the Dock. So we are bringing Freddie Mercury back. We will be having a Queen cover band. They are amazing. Tickets are $150,
Okay.
but that includes your admission, your drinks, and your food at the venue. It's at the Tampa River Center, so there's an amazing view of downtown Tampa. We're in for quite a treat.
Is this an outdoor event?
It is.
Okay, fantastic. I think I've been there. I think it is a great view of the city there. So that sounds like a wonderful event. Hopefully a lot of people come because you all are doing fantastic work. So I'm going to give you, I have one last question for you with the palliative care. How is that going to impact, I want to say medicine, as we're treating these types of people? How's that going to impact the medicine that's happening in Polk County and in our neighboring communities?
It's a great question. So when we think about delivering palliative care to people, there's more and more opportunity as we all have changed from the old 100 years ago where people tended to die from accidents and infections to now having chronic diseases. We have more and more people who are in that position where they're not dying, but they're not as healthy as they used to be. And every time they have a medical event happen, they really need some help to figure out what's the appropriate treatment. Palliative care does that very well. It's something that we did not mention that's important is that it is not the same as hospice in that you do not have to have a terminal diagnosis. You do not have to say, I no longer want to have aggressive treatment. So we see lots of people who are currently getting state-of-the-art, best care for their heart failure, their liver problem, their kidney problems, their cancers.
Thank you both so much for being here. I'm really intrigued by this event, so I'm going to look up a little bit more about it. And I wish you the best, and I hope that we can expand everything that's going on with all the branches of Chapters Health. You guys are doing wonderful things.
Thank you so much.
Thanks so
Appreciate
much
it.
for being here. Chapters Health invites you to Rock the Dock, a benefit for Chapters Health Foundation. Join them Saturday, October 26th from 6 to 10 p.m. for We Will Rock You with Absolute Queen. It is a spectacular live performance that recreates the sound and showmanship of one of the greatest rock bands of all time. It all happens at the Tampa River Center at Jillian B. Lane Park, 402 West Laurel Street in Tampa. You must be 21 or older to attend. For more information, you can give them a call at 813-871-8141 or look them up on the web at www.chaptershealth.org.